Hello, welcome everybody. Thank you for joining us today. We're going to give folks just a minute to jump on today, and then we'll get started in just a minute. My name is Olga Robak, and welcome to our public town hall today, where we will provide an update on the avian flu. We are just getting started, so we are giving folks just a few minutes to jump on. And in a minute, we should get started. So first, I wanted to let everybody know that our meeting today is being recorded. We will have this meeting available for viewing after we conclude. It will be available on our CDA YouTube channel. And we also do have Spanish interpretation available today. We have 2 interpreters with us today, and they will introduce themselves right now, and then one interpreter will repeat this message in Spanish.
Good morning. My name is Susana Say. I'm the interpreter for Spanish.
Good morning. My name is Alfredo Marcelo. I'm also a Spanish interpreter.
Okay, we now have interpretation available. So if you require interpretation, you can select the globe icon on your Zoom screen, and you can choose the language that you'd like to hear in. Let me go ahead and share my screen as well. All right, so like I said, we have interpretation with us today. If you need Spanish interpretation, you can click the globe button at the bottom of your screen and then select the language channel you'd like to hear in. You can also click mute original audio to silence the other language. You may select your language now. All right. As we get started today, I'd like to go over our agenda and introduce our speakers today. First, we will hear from Colorado State Veterinarian, Dr. Maggie Baldwin, about the current status of avian flu in Colorado. Next, we'll hear from Colorado State Epidemiologist, Dr. Rachel Herlihy, about how public health is partnering with the Department of Agriculture on the response. And then we'll facilitate a frequently asked questions section and answer any remaining questions you may have. If you're a member of the press, you can send your questions directly to the CDA Media email, which I will put in the chat in just a minute. And members of the public can use the Q&A function of Zoom to ask any questions. We will have a frequently asked questions section at the end of this webinar, and then you can definitely add any questions we have not answered. All right, so let me introduce our panelists today. We've got with us Dr. Maggie Baldwin. She is the Colorado State Veterinarian and the Director of Colorado Department of Agriculture's Animal Health Division. We also have with us Dr. Rachel Herlihy, State Epidemiologist and Deputy Chief Medical Officer at the Colorado Department of Public Health and Environment. And then to help answer any questions, we also have with us Scott Bookman. He's the Senior Director for Public Health Readiness and Response, also at the Colorado Department of Health and Environment. All right, so as a reminder to anyone who has just joined us, we do have Spanish interpretation available. If you need that today, please select the globe icon and use the Spanish language feature. And then if you have any questions that we have not answered during our presentation, you can add those to our presentation using the Q&A function, and we will pass those questions on to our subject matter experts.
Si ustedes tienen alguna pregunta, también pueden hacerlas haciéndola para nuestros expertos.
All right, and so now I will pass it over to Dr. Baldwin.
Ahora se lo voy a pasar a la doctora Baldwin para que ella empiece con nosotros.
And Susanna, we are actually hearing you on our English channel. All right, I think we got it. Okay, over to you, Dr. Baldwin.
Great, thanks so much. Olga, is the screen looking okay?
Looks great.
Okay, great. You can hear me all right?
Yes, thank you.
Okay. Well, good morning, everybody. As Olga said, I'm Maggie Baldwin. I'm the state veterinarian here at the Department of Agriculture, and really happy to be on with you this morning to give you an update on highly pathogenic avian influenza. This is a topic of a lot of interest, and our office, of course, has been receiving a number of questions, and we thought hosting a town hall for you all to provide up-to-date real-time information would be a good option. So hopefully today you'll get some good things out of this. As Olga said, if you've got questions for members of the public, please feel free to drop those in the Q&A, and we'll try to address those throughout our presentations. We'll also address those during the frequently asked questions. We did get a number of pre-submitted questions and went through those to make sure that during our presentations, we're covering those questions as well. So with that, we will get started. So before I tell you where we're at right now with avian influenza, I wanted to give you an overview of where we've been for the last 2 years. This is something that we've been dealing with here in Colorado, of course, across the United States for 2 years. And I wanted to give an overview of the virus itself and what we've seen in poultry and wild species over the last 2 years before we talk about our dairy industry and the impacts we're seeing on that side. So what is HPAI, highly pathogenic avian influenza? So first, it's a virus. It's an avian influenza virus. It's influenza A virus, and you can see the image on the screen. That's what the virus itself looks like. This is a virus that is typically carried globally by waterfowl and shorebirds in a variety of different combinations. So on that picture, you see some protrusions. Those are surface proteins on the surface of that virus. And the way that we classify avian influenza viruses is actually based on those proteins on the surface. So there's the H protein and the N protein, and there's a lot of different combinations of those different proteins. And you can see some of the combinations you may have heard before: H1N1, H5N1, which is the type we're going to talk about today, H3N2, H7N3. There's all kinds of different types of viruses. And this is something that birds globally, wild birds, they carry, and typically our wild birds are not affected by the virus. They are typically asymptomatic. They carry and shed the virus, but typically they don't become sick from the virus themselves. When we look at the specific kind of H5 and H7, those are the types of viruses that can become highly pathogenic, meaning that they can cause severe disease in poultry. So poultry is our birds like chickens and pheasants, turkeys, those types of birds. And what we see in flocks that are exposed to those highly pathogenic strains of avian influenza is significant illness and significant death in those flocks. And historically, we have also seen occasional spillover to other mammal species. And we'll talk a little bit about what we've seen over the last couple of years. And in mammals, HPAI can cause a variety of different symptoms. And we've seen that, from the different types of wild mammals that have been affected across the US, seeing a lot of different types of presentations. Some of it might be respiratory, some of it might be gastrointestinal, so GI type of symptoms. Some might be neurologic symptoms. So a variety of different symptoms in mammals. And avian influenza also is a zoonotic potential. And that's why we've got our partners here from the Colorado Department of Public Health and Environment to talk about what they're doing on that side to monitor on the human side. So this is just a nice picture that shows what that spread looks like. So it's a nice visual image for visual learners out there. So the virus, again, is carried and shed by our wild birds. So typically that's been geese and ducks and shorebirds, and it's carried in those maintenance hosts. And occasionally we see different types of viruses, throughout different migratory seasons. We'll see that the primary type of virus shift. And then as those birds are migrating, they're flying over farms and they're flying over, states and the countryside with all kinds of different poultry and livestock. So they're shedding that virus as they're migrating. And we see the spillover then into our livestock species and our poultry. So the spillover, what we've seen the last couple of years has primarily been in poultry, and then we'll talk about the difference in cattle. And then of course there is potential for spillover into humans, and that's our zoonotic potential for spillover. So this is what we've seen over the last couple of years. These are maps available from USDA. And on the left-hand side of the screen is the number of wild bird detections in each state. And what I'll tell you is that while, for example, in Colorado, you can see 295 detections, that doesn't mean that we've only had 295 birds affected here in Colorado. That just is the number that's captured on surveillance or mortality testing. So we've seen, here's the number of detections that we've seen in wild birds, but there have been a lot more birds that have been affected by the virus. And then on the right-hand side is what I was talking about with that spillover into wild mammals. So we've seen this in a variety of wild mammals, including our mountain lions, bears, so black bears, brown bears, seals for the states that are on the ocean states, red foxes, coyotes, skunks, so a variety of different mammals. And this spillover event into these wild mammals has made sense for us because those wild mammals are in high contact with those wild birds. They're in, they're preying upon or feeding upon those sick wild birds out in the wild. So it made sense that we would see that spillover into mammals. And then what we've seen, the spillover into our poultry operations. So this is a picture of what we've seen across the nation for the last 2 years. The first introduction of high-path avian influenza in the United States was early 2022, and that was into our poultry operations. And we've seen it, continued to spread since then. So we've had a total of 48 affected states with 1,129 confirmed premises across the U.S. And this is an epidemiology curve. So what's our time frame of when we've seen those that virus and those virus introductions into our poultry facilities? And this shows the time frame from February 2022 up until April 2024. And you can see that we have peaks and valleys. So the virus tends to come in during our migratory seasons when the migratory birds are coming in. And then we see a low and when those birds leave. And so we've seen that pattern over the last couple of years. What's really interesting about this particular virus, this H5N1 virus that we're talking about today, is that historically, when we have an introduction of high-path avian influenza, which is a foreign animal disease here in the United States, those have come in with the migratory season and then they leave, and we don't have continued reintroduction of the same virus. Usually we see that virus change over time. So for some reason, we don't quite know why, this virus seems to be sticking around. It seems to be sticking around in that wild bird population, and we're continuing to have introductions into our poultry facilities. Again, for the last 2 years, we've continued to see this. So this is an interactive map that's on our website. So you can see what has the virus introductions look like here in our state. If you go to ag.colorado.gov/HPAI response, this interactive website, interactive map, you can click on the counties and see those different introductions over the last couple of years, what has shown positive. And we're showing, and this is the work that's done, of course, by us at CDA and our partners at Colorado Parks and Wildlife, and of course CSU Veterinary Diagnostic Lab, that put all the work into tracking all of these positive cases. So we're tracking our wild bird cases from Colorado Parks and Wildlife, our domestic bird cases, so poultry and other types of domestic birds, and then any mammal cases. So this is an interactive map, and you should be able to click on that if you're interested in particular counties. So what has this looked like here in Colorado for our poultry operations? And my apologies, but I I've got to scroll back. The bar at the top is blocking some of the total numbers that I've got. But you can see we've had a number of commercial facilities, 9 commercial facilities, and that includes broiler breeder facilities. So those are the facilities that grow the chickens that become our broilers in the grocery store, our table egg laying operations, which are what produces our table eggs, and our pullet facilities. Pullets are the birds that go on to become table egg layers. And we've had 1 commercial game bird facility. And you can see we've had 25 non-commercial or backyard facilities, and those range in a variety of types of operations and a variety of numbers of birds on each of those premises. And in Colorado alone, we've had a total of more than 6.3 million domestic poultry have been impacted by highly pathogenic avian influenza over the last 2 years. So on the wildlife side, wildlife, of course, you saw on the other slides, we've had wild birds and wild mammals affected. And as I mentioned, a single detection in a wild bird doesn't mean that we've only had 1 wild bird. So we've actually had thousands of birds that have been impacted. And what has been another thing that's been different about this particular virus, H5N1, and this clade that we're seeing, is that this is causing mortality in our wild bird populations. So you can see we've had really large snow geese die-offs here in the state. We've also had Canada geese that have been impacted. And another difference in this outbreak is we're also seeing spillover into our raptors and scavenger birds. So we're seeing a wide variety of wild birds that have been affected over the last couple of years. And then the mammals here in Colorado is skunks, foxes, 1 black bear, bobcats, and mountain lions. And again, those are a variety of different types of clinical presentations, but this is all work that our Colorado Parks and Wildlife partners are doing. Okay, so that's a bit about where we've been for the last 2 years. And now I'm going to talk about what's changed and why we're talking to you all today to give you an update on high path avian influenza in dairy cattle. So in March 2024, what was reported to the state animal health officials, state veterinarians, is that there was a syndrome that was appearing in Texas and Kansas dairy cattle herds. It seemed to be they had similar symptoms that were going on, and it was impacting their lactating dairy cattle. So the symptoms that they were seeing were decreased feed consumption, decreased rumination. Some of our dairy cattle have monitors on so they can monitor the rumination in those animals and have an early indicator that there might be something going on. So that was actually one of the earliest indications that they had, was decreased rumination. And then they have a subsequent significant drop in milk production, and they produce a thicker, concentrated colostrum-like milk. They also have a little bit of abnormal feces and a low-grade fever. The good news is we're not seeing the same clinical disease that we see on the poultry side. So again, in birds, this causes significant illness and significant death. In dairy cattle, it causes a change in their milk production, but it's not causing significant illness. It's not causing mortality. The cattle, they appear to recover after supportive therapy. So in dairy operations, when cattle become ill, they get put in a hospital pen and they get taken care of by the dairy farmers and the dairy managers and their herd veterinarians, and they're provided with supportive therapy. And then those cattle seem to recover after supportive therapy. But in March of 2024, they were doing a lot of testing to try and figure out what this syndrome might be in Texas and Kansas dairy cattle. And all of the routine diagnostic testing that they were doing at that time came back inconclusive. And at the same time, they noticed the dairy producers and their veterinarians also noticed that on those facilities, they did have wild birds. They had cats that were clinically sick as well. And so somebody thought we should probably test for avian influenza. Now, in the past, we have seen occasional spillover of influenza A viruses into cattle. So that is not unheard of. It's not entirely, out of nowhere. So, but in this clinical presentation appears to be a little bit different, and that's what we'll talk about today. So they did confirm on March 25th, 2024, that it was highly pathogenic avian influenza, and it's the same strain that we've been dealing with here in the U.S. for the last 2 years. So this is, as I said, the H5N1. That's again those different types of surface proteins on the influenza virus. And then a further category is the clades of the virus. So this is H5N1 clade 2344B. And what we do know, and USDA has done a tremendous amount of work, as well as our CSU colleagues. We have one colleague from CSU AgNext that has been working really closely with USDA on looking at the potential transmission of this disease. So what we do know is they've done a lot of whole genomic sequencing of this virus. And whole genomic sequencing is one of the things that tells our scientists a story about where this virus has been. They can tell how that virus, or at least speculate how that virus came to be where it is, and they can see the evolution of that virus as it's transmitted throughout different cows and different herds and different birds. So what they do know is that this was the initial introduction into dairy cattle was by wild birds. So this was one of those spillover events into mammals. And they estimate, looking at the whole genomic sequencing, that happened sometime around December 2023. What's a little bit different is that though that initial introduction was by wild birds, the ongoing transmission that we're seeing from cow to cow within a herd and then from farm to farm appears to be direct transmission. So we don't yet know the exact mechanism of that, but we do know that the movement of this virus has been associated with movement of cattle. So moving cattle from an affected herd to an unaffected herd introduces that virus into that new herd. And so we know it's been associated with movement. And we also know that there has been some movement of the virus from dairy farms to adjacent poultry farms. And so that's one of the things we'll talk about is biosecurity and why monitoring those movements, making sure we're not moving sick animals is really, really important. The other interesting thing about this virus is in cattle, it appears to really have a predilection for the mammary tissue. So we're seeing high amounts of virus in the milk. The good news is that the FDA has done studies and they have confirmed that pasteurization continues to be effective. Pasteurization has been proven to be effective against this particular virus. So our commercial milk supply is safe. You might also hear this called influenza A virus, bovine influenza A virus. Those are all technically correct. It is still highly pathogenic avian influenza, but also you might hear it bovine influenza A virus. And then here in Colorado, we did confirm our first case of high path avian influenza on April 25th, 2024 in a dairy in the northeast corner of our state. So as I mentioned, there's still things that we don't know about this virus and how and why it's impacting dairy cattle the way it is. So we don't know the exact incubation period in dairy cattle, meaning we don't know exactly from the time dairy cattle are exposed to the time they become ill from the virus. We don't know the exact mechanism of transmission. So we don't know, whether it's being shed and spread in the milk because there's high loads of virus in that milk, or whether maybe there's a short respiratory phase of this virus. We don't know what that mechanism of transmission in dairy cattle is, but there's a lot of really great people that are working on studying that to give us a better idea of that. And once we know that, we are hoping that that's going to also help us stop the transmission. When you know the mechanism of transmission, you can put measures in place to prevent spread. We also don't know how long are the dairy cattle shedding this virus. So once they become infected, how long are they going to continue to shed that virus? And we also don't know yet the risk of this virus impacting non-lactating dairy cattle or other livestock species. We really don't know yet. And there's a lot of questions about that, and there's a lot of work going into that. So some things yet to be discovered. So as of May 7th, 2024, we have had 9 states impacted with a total of 36 dairy premises affected across the US. And right now, USDA is working tremendously hard on a lot of diagnostics. They're really trying to support the states and our dairy industry to the best ability that they can. So the way that our diagnostic testing works is we send our samples to Colorado State University Veterinary Diagnostic Laboratory. And then if we get a presumptive positive test back, those tests then have to go to USDA National Veterinary Services Laboratory for confirmation. And right now, their testing capacity is pretty maxed out. So they're doing a lot of testing. And so some of our presumptive positives are taking just a little bit longer than usual for confirmation. That doesn't change the way that we manage them. That doesn't change any course of disease. It just changes that it takes a little bit longer to get those confirmations posted on the website. So we're being really patient as we are all really taxed during this response, and understanding that USDA is doing what they can. So to give you an idea of who those partners are that are working on this. So there's a lot of different acronyms that we like to use in the government, and I'll try to explain those here on this slide a little bit. But it's also helpful to know when you hear those, what their role is. So at the federal level, the USDA, which is United States Department of Agriculture, is the lead on the animal health side. And that's true for the poultry side, that's true for the dairy cattle response, that's true even on the wild bird, because they have USDA Wildlife Services. It's on the wild bird side doing the wildlife surveillance. CDC, the Center for Disease Control, is the human health lead, and they're taking lead on monitoring and providing guidance to state partners on monitoring human health. And FDA, the Food and Drug Administration, is lead at the federal level on the milk safety lead, again, providing that guidance and overarching support for states. All these partners at the federal level are coordinating on their response. So at the state level, the same is very true. I feel very lucky to be in the state of Colorado and have really phenomenal response partners that we've worked with on a lot of different disease outbreaks. I think one thing that a lot of people don't know, because we often work behind the scenes, is disease response is kind of what we do every day. It's a different kind of disease. It's a different type of disease that we deal with. And so all of these partners that you see on the slide here are people that I work with every day on a lot of different diseases. Just not all of them make the news. So this is a good one to get out in front of, and you guys getting accurate information, and so you know who to contact if you've got questions on specific pieces. So Colorado Department of Agriculture, of course, that's where I'm at, and we're the lead on animal health response in the state. The Colorado Department of Public Health and Environment and our local public health departments are the lead for human health and human health monitoring. CDPHE also houses the milk program, so they are also lead on milk safety. And then the Colorado State University Veterinary Diagnostic Laboratory, that is our NALN laboratory. So that's the National Animal Health Laboratory Network lab. And that's the lab that we send all of our diagnostic testing to, because influenza, highly pathogenic avian influenza, is a reportable disease. It has to be tested at the NALN laboratory, and we work really closely with them. And then, of course, Colorado Parks and Wildlife is the lead on wildlife response. So one thing that changed pretty tremendously over the last couple of weeks is that USDA, in an effort to try to curb the transmission and movement of this disease across state lines, they issued a federal order on April 25th that went into effect on April 29th. And then we, in order to adopt the parameters of that federal order and to protect the health of Colorado's herd, we adopted that as an emergency rule on April 30th. So what does this require? It requires mandatory reporting of positive cases. So in Colorado, that was already required because it is a reportable disease. But at the federal level, it's required that we report it to our federal colleagues. It requires owners of positive herds to provide epidemiology and movement information. And this is really important so we can get a better understanding of the spread of this virus and how we can stop the spread of this virus, right? If we understand the mechanism of transmission, we can put measures in place to stop that. It also requires mandatory testing of lactating dairy cattle moving across state lines. So if you're moving dairy cattle, from Colorado to another state or from another state into Colorado, those dairy cattle, if they're lactating, have to have a test. And we'll talk about that here in a second. Unless those cattle are moving direct to slaughter, but that still requires a certificate of veterinary inspection. So it requires a veterinarian to look at them and determine that they're clinically healthy and free of disease and able to move to slaughter. Clinically affected lactating dairy cattle are ineligible for interstate movement. In Colorado, they're also ineligible for intrastate movement, meaning within the state, because they'll be put under a quarantine, and we'll talk about that. And that's for a period of 30 days. And then after that 30 days, they have to be retested. Okay, so what does this testing look like? So the pre-movement testing, this is, again, for the non-clinical lactating dairy cattle that are moving across state lines. The samples need to be collected by a veterinarian within 7 days of movement. And then if you're moving groups of animals, if there's less than 30, all of the animals need to be tested. If there's more than 30 in that group, then a total of 30 of those animals need to be tested. And they're testing milk samples and submitting that to the National Animal Health Lab here in Colorado. That's CSU, Veterinary Diagnostic Laboratory. And then if veterinarians are writing that CVI, Certificate of Veterinary Inspection, or health certificate, the results have to be included on that. There also is an option for voluntary testing. It's the same type of testing. USDA is covering the cost of testing at the lab. The associated costs, so cost for shipping the samples or supplies or veterinary expenses, are not covered. But for dairies, for example, that don't fall under that pre-movement testing, so if you're a dairy and you're not moving a lot of animals across state lines, but you'd like to monitor your herd and make sure your herd is healthy, you would be able to qualify for USDA covering the cost of that test at CSU. So we would encourage you, if you're interested, please reach out to your veterinarian, and your veterinarian can reach out to us on how to collect those samples and submit those samples. So what does the response here in Colorado look like? Of course, I mentioned a couple of times, it is a reportable disease. So anybody with knowledge or suspicion of a reportable disease must report that to our office. Typically, we get those reports from veterinarians, of course, they're required to report. We also get those reports from diagnostic laboratories that are doing the testing, but also owners could also report to our office. But if you are an owner and you have animals that are suspect for disease, we ask that you work with your veterinarian, and then your veterinarian contact us. So we will assign a case manager, and that's one of our veterinarians. So one of our state or federal veterinarians here in Colorado, we've got a really tremendous team out there, and they do a really good job working directly with those private practicing veterinarians of that herd and the animal owners. And they'll walk through that epidemiology questionnaire to try and help us understand maybe where the virus came from to that farm specifically. And they also provide movement information. So the owners will provide movement information to us, again, to help us understand, did it come from an affected herd, or do we need to go back to another herd that might be affected and they might not know it yet? We do in Colorado implement a quarantine, and that is for 30 days for lactating dairy cattle. So non-lactating dairy cattle can come and go off of that premises, but lactating dairy cattle are quarantined for 30 days after confirmation. And of course, because we're early in the response, and this is still a little bit newer, we will adjust any of our response activities as we learn more about risk and potential modes of transmission. So right now, this is our response, but we need to be able to have our response be flexible and make sure that we can adjust as needed as we learn more about this virus. And we work really closely with CDPHE. So Dr. Herlihy will talk next about what their role is on the public health monitoring. So for individuals on farms that are positive, how do we monitor them and ensure that the virus isn't moving? And this response is whether it's clinical disease or whether there's a positive on any type of testing. Okay, so a few key points, and I've talked about most of these throughout, but just want to emphasize that our commercial milk supply, because pasteurization is effective, and our meat supply is safe. You all may have heard in the news that they had done some testing of meat off of the grocery store shelves, and they did not find any virus in that. So good news. Our commercial milk supply and our meat supply is still safe. We're doing all that we can, of course, on response on this and ensuring that we're limiting that transmission as much as we can. Biosecurity measures in order for us to limit that transmission are really, really important. There's a lot of really good resources available. We have them up on our website. USDA has resources available on their website to look at which biosecurity measures do you need to be implementing for your farm. Whether you've got a small farm or a large farm, how do we implement biosecurity measures to limit the transmission of this disease and stop the spread of the virus to additional herds? So again, producers, contact your veterinarian if you suspect that you have a herd that's clinically ill. And veterinarians, please contact our office. It's reportable to us, and we will work with veterinarians on sample collection, sample submission, and any follow-up that's necessary. And we continue to say this is an evolving situation. So we will be adjusting our response as new information becomes available. And we'll be sure to coordinate that with all of our response partners and message that out to the public and work really closely with our dairy industry. Here in Colorado, we've been really fortunate. We have a lot of really great stakeholder engagement. We've got a lot of really good industry partners that we're working on this response with and ensuring we have a coordinated response. And that certainly includes our dairy producers here in the state of Colorado. So I feel very fortunate, again, to be in a state where we're really in lockstep with everybody that we need to be on this response. So with that, that is the end of my presentation, and I am going to turn it over to Dr. Rachel Herlihy with CDPHE to go through her presentation on the human health side.
Great. Thank you so much, Dr. Baldwin. And as Dr. Baldwin described, this really continues to be primarily an animal health issue, but I do want to provide you with a brief update on the work that we are doing on the humans health side here. So next slide, please. So we are continuing to work very closely with our partners at the Colorado Department of Agriculture, including Dr. Baldwin and other staff, also working closely with local partners, other state partners, and the federal government, including CDC. And so on the public health side, we are actively monitoring this situation, working closely with our ag partners to make sure that we are responding to the emergence of H5N1, including this most recent situation in dairy cattle. We are following CDC guidance as far as the monitoring of individuals that may be exposed to this virus, as well as ensuring that individuals that might develop symptoms after exposure have access to testing and treatment. But overall, CDC continues to acknowledge that the risk to humans is low, but we know that that risk is going to depend on exposure. And we know that people that are more likely to be exposed are going to be people that are actively working with potentially sick birds or cattle. And so that is really the reason for the monitoring strategies that we have in place and working closely with our agricultural partners to make sure that we are in close contact with any dairies that might be affected and have the opportunity to watch for symptoms in any individuals that are being exposed. But at this point, no person-to-person spread has been identified with this current H5N1 virus. And if you look at this figure here, you can see that just 2 cases associated with these recent H5N1 high-path avian influenza viruses have occurred. One of those was here in Colorado in 2022, but we believe actually that individual likely had the virus present in their nose and tested positive, but did not actively have an infection. The second case was recently, just this year, a month ago. We had a case in a dairy worker in Texas, and that individual did have symptoms and likely did have a real infection, but their infection was quite mild. In fact, their symptoms were limited to conjunctivitis or pink eye. So again, very mild illness that we're seeing at this point. And so based on the laboratory studies, the whole genome sequencing data that Dr. Baldwin described, as well as our epidemiologic studies, at this point, we do not believe that this virus has adapted to be able to spread from person to person. So additional genetic changes would be needed in this virus for that to be able to happen. But we know that as viruses like this one have the opportunity to infect more species and spread more widely, that viruses have the opportunity to evolve and encounter humans more often. And so really that is the impetus behind a lot of the work that we're doing right now to prevent human exposures. Next slide, please. And so some of the things that we are doing closely with our agricultural partners are working to ensure that we are keeping these workers safe in agricultural industries and also in wildlife industries. So that includes worker education and training, ensuring that workers have access to personal protective equipment that's needed to prevent transmission of the virus to humans, monitoring workers for symptoms, as I mentioned, testing any workers that might develop symptoms, and antiviral treatment. So anyone that develops symptoms after having an exposure, we would want that individual to take a medication like Tamiflu, at least until we get the results of any testing back. As far as preventive actions for the general public, we continue to ask the public to please avoid contact with sick birds and other animals. That's a really important strategy to avoid exposure to this potential virus. If you must handle sick or dead birds or animals, we really want individuals to be wearing a proper PPE. There's lots of great information available on CDA's website, CDC's website about the appropriate PPE to wear. And as you heard from Dr. Baldwin, it is safe to eat properly handled poultry and meat and drink pasteurized milk. Also, I want to share that the systems that we have in place to track seasonal influenza every year are the same systems that we are relying on now to determine if we are seeing any changes in the spread of influenza. So those systems are active and we are monitoring those systems to see if we see any changes in the number of influenza cases that are occurring in people. Next slide, please. So in conclusion, just a couple of key points here. The current H5N1 public health risk assessment for the general public continues to be low. We know that human-to-human transmission of the current circulating virus is considered unlikely without additional further genetic changes in the virus. But current prevention and preparedness actions are important because we know that influenza viruses have the potential to constantly change and evolve. And so we want to be ready, we want to be partnering with our agricultural partners and ensuring that workers and others are safe. Thank you.
Thank you very much, Dr. Herlihy. Let me stop sharing my screen. Actually, here we go. Moving right into our frequently asked questions. All right. Okay, we, like Dr. Baldwin mentioned, we have received a number of questions ahead of this webinar. And so here are some of the most frequently asked questions. So Dr. Baldwin, the first couple questions I have are for you. First, can you tell us how did dairy cattle become infected with highly pathogenic avian influenza?
Yeah, thanks, Olga. And this might answer a couple of the questions that I saw in the Q&A as well. So as I mentioned, The virus that we see in dairy cattle is the same virus that we have seen circulating in our wild bird population for the last 2 years. It's the same virus that we've seen spill over into poultry and spill over into wild mammals. So we don't know the exact mechanism of transmission, but what appears to have happened is we had a spillover event from a wild bird into a dairy cow sometime around December 2023. And since then, we've seen that that virus continue to spread within our dairy cattle population. So it is the same virus that's impacting birds and dairy cattle at this point in time. But what's important is after that spillover event happened into dairy cattle, the transmission is from cow to cow. So we're not seeing additional movement of the virus from birds at this point in time. We're seeing movement of the virus between cows and between herds.
Thank you. And what signs of illness should we monitor for in cattle?
Yep, so it's really the same signs of illness that they saw early in that syndrome that I had on one of my slides. So the earliest indication that they're seeing right now is a decreased rumination, and that's for cattle that have rumen monitors on, that you can detect that very early on. So decreased rumination, followed by decreased feed and water consumption for cattle that are monitored. Of course, dairy cattle are a highly monitored population. Their health is monitored every minute of every day, and they've got a lot of really good tech that work on that, and they can look at it behind a computer screen and monitor those things. So those are the early signs, followed by a subsequent significant drop in milk production. And the milk that they are producing is a colostrum-like consistency, so a thicker consistency than a normal milk. And then they also might have a slight fever and tacky stools.
Thank you. Dr. Herlihy, the next question I have is for you. You mentioned this in your presentation, but can you tell us one more time, are people at risk because of this outbreak in cattle?
Yes. So at this point, based on the genetic studies that have been done of the viruses that have been isolated, and this work is obviously ongoing, adaptations to mammalian transmission to humans have not been identified. And so because of that, we really do not believe that this virus is adapted to spread from person to person. But as Dr. Baldwin has described, there can be these occasional spillover events that happen between species. So most of the time, an influenza virus is going to transmit just within a given species. But these spillover events can happen. And that's really much of the reason that we want workers to be protected, to protect themselves from those potential spillover events, even though this virus is not adapted to spread from person to person.
Thank you. Dr. Baldwin, a technical question for you. What is the test used to detect avian influenza in cattle?
Yeah, so again, at CSU, the Veterinary Diagnostic Laboratory, that's the lab that's approved for avian influenza testing in animals here in Colorado. They first do a screening test. The screening test tells them, is this an influenza A virus? If we find out that it is an influenza A virus at the lab, then they do further testing. And the next test that they do is a PCR test to say, what kind of influenza A virus is this? Is this H5N1? So then the PCR test will say, yep, that's H5N1. And then after that sample goes to the USDA National Veterinary Services Laboratory, they do the whole genomic sequencing to, again, tell us that story about how that virus became the virus that it currently is.
Thank you very much. All right, our next question, which you also covered, but I think would be great for one more review, is the commercial milk supply and meat supply safe? Yes, the answer is yes. The commercial milk supply, we have the pasteurized milk ordinance with, I believe it just celebrated its 100-year anniversary of having a commercial pasteurized milk supply here. Pasteurization is effective in killing the influenza A virus, the H5N1 virus. So good news, commercial milk supply is safe, FDA confirmed that. And the testing that they've done in the meat so far has shown no virus. So good news on that. Thank you. And are there concerns for beef cattle or other livestock species?
This is a question that we're getting very frequently because, this is still a newer situation. So right now we've only seen it in dairy cattle, but this is a question that we've had, and we're talking with our USDA colleagues about, for example, do we need to be worried about beef cattle? At this point, we have not detected this particular virus in any other livestock species. I should clarify that there was one spillover event in Minnesota that happened into some goat kids, but that was a entirely separate spillover event, again, from birds to the goats, that is entirely separate from what's happening in the dairy cattle. And the whole genomic sequencing helped us tell that story on how that happened. So right now we don't know of any other concern for beef cattle or livestock, or other species of livestock, but it is something that they're continuing to monitor, and that our USDA colleagues, as well as our CSU colleagues and a lot of other folks that are working on this are monitoring.
Thank you. All right, I have one more for you here. Do you know how the virus is being spread between cows?
So we don't quite know that yet, but we're getting a little bit better picture as we have additional herds that are detected, and they're working really well with our state partners and our federal partners. They're working closely on, giving that epidemiology information, so that movement information. How can we try to decipher the exact mode of transmission? Right now, again, like I mentioned during my presentation, a couple of the theories for the modes of transmission is that it's being spread in the milk because the milk has high virus loads in the dairy cattle, or there might be a short respiratory phase of this virus in dairy cattle, and they might be shedding it in a respiratory manner, which we see typically with influenza viruses in all kinds of species. So that wouldn't be an uncommon occurrence if that were the case, but we don't quite know that yet, but we're working on figuring that out. We do know it's cow-to-cow transmission, and it's movement associated, which is why that pre-movement testing is so important.
Thank you, Dr. Baldwin. Dr. Herlihy, my next question here is for you. What should dairy owners and farm workers do, and how can they protect themselves?
Yes, so certainly watching for signs and symptoms of illness in cattle, but also watching for signs and symptoms in workers is really important. And the types of signs and symptoms that we would expect to see in humans is pretty similar to typical influenza. So things like fever, cough, sore throat. But we also know that exposure to the eyes can result in pink eye or conjunctivitis, and that was the syndrome that was identified in the dairy worker in Texas. So keeping an eye on those types of symptoms. And as you've heard from Dr. Baldwin, this is an evolving situation. So of course, staying in touch with us at CDPHE, as well as CDA for the latest information, and making sure that you are aware of any changes that might be occurring. I would also say for any dairies that may be affected, we have access to PPE and are happy to share that protective equipment to affected dairies or other dairies that might need personal protective equipment for their staff. Thank you.
Thank you very much. All right, and then back to you, Dr. Baldwin, just a couple questions here. Do we still need to worry about avian flu in birds and poultry? And, I actually have one more in the Q&A, which asks about dairy goats.
Okay, yes. So yes, we do need to worry about avian influenza still in birds and poultry. We're still continuing to see that spillover happen into our poultry operations, backyard operations. What changes that picture a little bit now is we have virus circulating now within our dairy herd. So that's another potential route of transmitting the virus from dairies back into poultry operations. So now that's, just a little bit more biosecurity that our poultry operations need to work on, of course, our dairy operations as well. But yes, it is still a risk to birds and to poultry. The question about goats, that did seem to be a very specific event that happened in Minnesota into the dairy kids. And it happened on a farm that had recently been diagnosed with highly pathogenic avian influenza in their poultry on the farm. And so they had a large amount of virus on the farm. It was a multi-species farm, and they had multiple species that were housed together, but they didn't see any additional transmission of that virus. It impacted the neonatal goat kids, and no additional. So at this point, we haven't seen any additional concern on that side.
Okay, and then finally, it is about to be fair season. Is there anything we should know?
Yep, this is a question we've been getting a lot. And as you all probably remember, when we first had a highly pathogenic avian influenza in poultry, we did put out guidance on fairs and shows and what we should do to keep our poultry and our domestic birds safe during fair and show season. Right now, because this is a rapidly evolving situation and we're still learning more as we're going, we don't have guidance yet drafted. We have talked with USDA about this. It sounds like USDA is looking to issue some guidance specific for shows and fairs. And so we will follow their lead. But show and fair season, even though it's coming up, with it being a few weeks away during this outbreak, a lot can happen in a few short weeks. And so we want to make sure that if we put guidance out, that it's as up to date and timely as possible. So we know that there's concerns and questions, and we're just going to ask everybody to be patient with us as we work to put that guidance together and get that information out to folks.
All right, thank you so much, Dr. Baldwin. Those were all of our prepared questions. I do have a few questions here in our chat. Dr. Herlihy, I am going to send this one your way. I have a couple of questions here about vaccines. Are there any in development? Is this something that is a preventative measure?
Yes, so on the human health side, there is an H5N1 vaccine that has been developed, and limited amounts of that vaccine are stockpiled by the US government. At this point, the studies that have been done looking at protection of that vaccine against this currently circulating strain are very reassuring and demonstrate that the vaccine would offer protection. Of course, important to keep in mind that viruses are always changing. That's the reason we need a seasonal influenza vaccine each year. So scientists, the government, are going to be keeping an eye on this virus and looking at that match between the vaccine and the virus over time, and adjusting if that needs to be done. At this point, I'm not aware of any federal plans to distribute or use that vaccine, but of course, evolving situation, and we're going to continue to pay attention to guidance from the federal government.
Thank you. And I have one more for you, actually. Can you tell us, are there any folks being monitored for avian influenza, and what is your protocol?
Yes, so at this point, we are monitoring about 70 individuals here in Colorado, and that is very consistent with federal CDC guidance on how to conduct monitoring. And so what we do is we receive information about whether any of these individuals have developed any symptoms. At this point, no individuals have developed symptoms here in Colorado, but if people were to develop symptoms while being monitored, we would ensure access to testing, access to treatment, and then follow that result. And if that result was positive, we would ensure that someone was to stay on treatment through the full course to make sure that that their infection would continue to be mild.
Thank you. Dr. Baldwin, two animal-related questions. Have wild pheasants developed resistance, and why do mammals such as skunks or foxes act as high carriers of these diseases?
Both good questions. We have not seen, to the best of my knowledge, and this might be a question for our wildlife partners as well on the pheasants, resistance to this specific strain of avian influenza in the wild birds. Again, this picture has been a little bit different than what we've seen in the past, because we're seeing those wild birds become clinically ill and dying from this virus, and we've seen it impact pheasants as well. I don't know the total number of wild pheasants. I know for our game farms that have pheasants, we've certainly seen them impacted by the virus. So I don't know that there are any wild birds out there that are developing immunity specifically, but I might have you check our wildlife sources on that to see if they might have clarity. And the second question was on why are we seeing this in skunks and fox and in these wild mammals? So those wild mammals are in a much higher contact with higher loads of virus in the wild, because it's wild birds that are shedding and carrying this virus. So, skunks and foxes are preying upon those wild birds that are sick and dying from the virus. So they have a high contact rate with the virus, a higher likelihood of transmission. And, that's true across the board when we think of other diseases, things like rabies virus, for example. So we tend to see, viruses impacting them. They also typically don't have immunity. They're not vaccinated. They're not a vaccinated population in the wild here in Colorado anyway. So that's why we see those in those wild mammals for spillover events.
All right, I have one more question for you, Dr. Baldwin, about the emergency rule and the federal order. What are those regulations concerning movement, pre-movement testing requirements?
Yep, so lactating dairy cattle have to be tested before movement if they are moving across state lines. We're also encouraging anybody, if you're moving lactating dairy cattle, even within state and want to test, USDA is covering the cost. But the requirement is lactating dairy cattle moving across state lines must be tested for influenza A virus. And here in Colorado, that has to be done at the Nuln laboratory, so at CSU Veterinary Diagnostic Laboratory. Those have to be collected by a veterinarian or an accredited veterinarian, a licensed veterinarian, and they have to be collected within 7 days of movement. So it's a pretty short time frame to get that test done before you move. So make sure you're contacting your veterinarian ahead of time and planning that. The only thing that's different is if the animals are moving across state lines directly to slaughter, to a federally inspected slaughter establishment, they don't need to be tested prior to movement, but they have to be inspected by a veterinarian and be determined to be free of disease.
Thank you very much. We have just a few more questions here left. One of them, has there been any testing done in other livestock species, including swine or beef cattle?
So to the best of my knowledge, we have not yet tested this particularly for this virus. There's a lot of influenza surveillance that goes on for swine, for example. Swine are really good mixing vessels for influenza viruses in general. But to the best of my knowledge, they have not tested yet for this particular virus. They are looking at that at the federal level, USDA. That is a question that we've talked with USDA about in looking at how are they looking to potentially expand their surveillance into other livestock species? And I don't believe at this time they are.
Thank you. Dr. Herlihy, is there any flu wastewater surveillance being done?
Yes, so Colorado does have a pilot influenza wastewater surveillance program in place, and that's been in place for a couple of months now. And the way that wastewater surveillance for influenza is done is it first is looking for overall markers of influenza virus. So not specifically looking for H5N1. It's generally looking for influenza virus in wastewater. And at this point, we have not seen any increases in influenza virus in the last few weeks in Colorado. So no unusual increases. What we would do if we did see an increase in influenza in wastewater detections here in Colorado is we would then go on to investigate what type of influenza we were seeing in those detections. But again, at this point, we have not identified anything unusual in the state.
Thank you. Dr. Baldwin, a question for you. With avian flu in birds, there is a mass casualty event. Is that also a scenario that happens in dairy cattle?
No, it is not. So the good news is, while we do see on the poultry side, it is highly pathogenic. We do see them become clinically ill and a really high mortality rate. We are not seeing that in cattle at this point, in dairy cattle at all. The cattle that become clinically affected, again, they have symptoms that I described earlier. They're pulled off of the milking string, put in the hospital pen, tended to, provided supportive therapy, and seem to recover after supportive therapy.
Great, thank you very much. All right, I've got time. We've got time for maybe another question or two. I will combine two questions here, Dr. Baldwin, for you. What is the timeline for sample collection? And I see you trying to answer the other one, which is there any support from the USDA for testing lactating cattle?
Perfect. Yes, I was trying to type as you were asking questions. So timeline for the collection, it's required to be collected within 7 days of movement and submitted to the diagnostic laboratory. Typically, the turnaround time at CSU Veterinary Diagnostic Laboratory, at least right now, we're getting results back the following day. So, within 24 hours, they've got a pretty good turnaround time. Of course, that could change at any point in time if they get a really high volume of samples. And Dr. Adams asked a question, is USDA paying for testing in state? And USDA has said that they are willing to pay for any testing in dairy cattle, for any dairy cattle that want, whether it's out of personal interest, whether it's for movement, whether it's for required testing. They will pay for that testing at the Nuln laboratory. They won't pay for any of the associated fees, but they'll pay for the test itself.
Okay, thank you. All right, I've got one final question for you, Dr. Baldwin. Do we know where the spread of avian influenza came from in the Colorado herd that was confirmed to have a HPAI infection?
Yeah, good question. And we do not yet know that. We're putting those puzzle pieces together. And we've got whole genomic sequencing. We're working with our USDA partners. I'll tell you, our dairy producers have been truly fantastic partners in this. And they're working with our field veterinarians, Dr. Ken Newens, Dr. Rich Ann Lumpkin, on the epidemiology information and trying to get us that picture of what the movement looks like and what the potential introduction and spread of the virus might have been. We don't yet know that, but we are working on that and hope to get some answers, again, because the goal in getting those answers is, how do we stop additional spread of this virus?
Thank you so much. I think we've covered the biggest questions we've had in our Q&A. I am dropping right now into our chat an email for anyone who wants to follow up with us, any members of the media or anyone whose question was not answered. If you'd like to follow up, you can email cda_communications@state.co.us. Thank you both again, Dr. Herlihy and Dr. Baldwin, for sharing what you know with us today and many of the unknowns still. I wanted to just pass it on back to you, Dr. Baldwin, for any closing words.
Yeah, thanks so much, Olga. I appreciate it. I really appreciate everybody joining today. I mean, I think we reached nearly 150 interested folks in this topic. The more that we get, the information out there, the better. I really want to thank our partners. So Dr. Herlihy, Dr. Bookman at CDPHE, and all of our other CDPHE colleagues and all the other acronyms that you saw earlier. This is a really coordinated effort. I feel really fortunate to be doing this in the state of Colorado. But I also really want to thank our producers, our dairy industry partners that have been helping on this. So thanks again. And Olga, thanks to you for helping us organize this today.
Thank you. Thanks so much, everybody. And we really appreciate you coming to this webinar. And again, this webinar will be posted on our CDA YouTube link if you would like to come back to it for any information. Thank you so much, everyone. Have a great day.